Hello, welcome. The purpose of this short video is to review some concepts as you have discovered more about innate immunity this week, and you have delved a little bit deeper in your reading as well as your recorded lecture and then your class discussion with your groups. Now we're going to take that information and see if we can apply it to real life situations and see how well our active recall is this far. Okay, so I have a scenario for you to think about. Now, if you were called as a nurse or a nursing student to teach in the community about innate immunity, okay, and you're really trying to stress health promotion, what are you going to include? Now, as a public health nurse or any nurse that is tasked with going out and teaching the general public, you need to first help your patients or your community understand some key concepts of innate immunity. So, for instance, understanding again what the physical barriers are, our skin, our mucous membranes, being that of first line defense. And this is helping us to create that physical barrier preventing pathogen entry. So having good and proper hygiene, skincare, and also the use of sunscreen because we're trying to maintain our skin barrier integrity. We also need to discuss biochemical defenses like our saliva, our tears, our mucus, and even stomach acid as ways that can trap and kill microorganisms. We think about the lysosomes that are in our natural tears and the saliva that breaks down bacterial cell walls. These are really important to stress and to educate as well. We also have stomach acid, which helps to neutralize pathogens. So, stomach acid is not all necessarily negative, which patients that have gastric reflux may contend with that statement. Now, we want our community to understand that we also have a natural microbiome, and the beneficial from the microbiomes on our skin and the gut, they really are there to outcompete the harmful pathogens that can cause disease. And for health promotion, and something you'd want to share with the community is to have a healthy diet. They want to have a diet rich in fiber. They want to use probiotics to support their gut microbiome as well. And then lastly, if we're just talking about immune education as a whole, we talk about how vaccines and vaccinations have trained the adaptive immune system but also bolsters and supports the innate responses in our body. Overall, this helps the body respond faster and more effectively to infection. The next question I have for you is, and some of this we just talked about, but we're going to get more detail now. But think about the microchemical secretions that help to trap and kill microorganisms. We talked a lot about mucus already. Mucus traps microorganisms in different areas of our body. Can you think of an area that you most link or connect to mucus? If you said in your respiratory or your GI tracts, that's correct. For example, the ciliary action in the respiratory tract helps to move mucus, but it really is there to trap particles upward and try to help to expel them so that you're able to remove it from your body or it will be swallowed. Antimicrobial peptides are other um, chemical secretions or biochemical secretions that you want to consider. We have, as antimicrobial peptides, we have defensins. And defensins insert into microbial membranes, and defensins will create pores, killing bacteria. We also have what we call catalysidins, and they will disrupt the bacterial membranes, which will then neutralize the toxins itself. Okay, so those are the catalysidins. Then we have enzymes and lysozymes. Specifically, we just talked about how they're found in our tears. We have lysozymes in saliva and mucus. And with the lysozymes, they're going to help to degrade the bacterial cell wall. We also have proteases. These can be found in the digestive tract, and they break down proteins in the pathogens themselves. And the last thing I want to just stress is the acidic pH, especially in our stomach and in our skin. Where we have low pH, this inhibits pathogen growth. Now, before I get into the next question, I want you to take a pause and think about the purpose of the inflammatory process, why our body has inflammation, and what is the role of a mast cell in that inflammatory response. Okay, let's answer those questions. Now, the inflammatory process is a critical component of innate immunity, and it has several purposes. It helps to contain and eliminate the pathogen. When your body goes through this cycle of inflammation or this process of inflammation, it's going to trap the pathogens locally. And what we're trying to do is prevent spread to other areas of the body or other organ systems. Also, inflammation helps to recruit immune cells. It draws leukocytes like neutrophils and macrophages to where the infection or the site of the injury is. We need those immune cells to help start the repairing process. It's also going to promote tissue repair. It increases blood flow, delivers essential nutrients. We have growth factors that come into play. And overall, this inflammation, though sounds counterintuitive intuitive in the beginning, it's really going to facilitate tissue healing. Last thing that I want to point out for this is that it also plays a role in signaling our adaptive immune system where cytokines and chemokines will be released during inflammation, and it's going to help activate adaptive immunity, which we'll get more into next week. I did mention that the role of mast cells in the inflammatory process or response is also important. It plays a pivotal role in initiating and amplifying this inflammatory response. So we have degranulation, and degranulation, when this period is activated, mast cells become released. So what causes degranulation? What activates it? Injury or a pathogen entering your body. The mast cell is going to be released, and what comes with mast cells? Histamine, right? Histamine plays a variety of roles in this inflammatory response. It increases vascular permeability, which allows our immune cells to access the affected area, right? Think about that for a second. Vascular permeability. We're able to penetrate where we need these immune cells to go. Now, the proteases will degrade pathogens, and the extracellular matrix will facilitate immune cell migration. This happens in this period we call degranulation. Now, the synthesis of these mediators happens, lipid mediators like prostaglandins and leukotrienes, and this also will amplify inflammation. The way it does this is that it promotes vasodilation and it attracts leukocytes or white blood cells. And then we have the cytokine release. And this is when mast cells produce cytokines like tumor necrosis factor alpha and interleukin 4. You might see it in your book as TNF alpha or IL-4. But both of these things will enhance the recruitment and the activation of immune cells. Okay, so really important to realize that during inflammation, we have, and specifically the amplification of inflammation, we will have vasodilation, and we also talked about having additional leukocytes being attracted, and we have mast cell release. This all is in cohesively the role of the mast cell in the inflammatory response. Now, we're going to take another pause before we start talking about the directional migration of leukocytes, which happens along a chemical gradient. So you might want to go to your textbook to refresh or take a minute to pause and try to recall your learning.